I had given a version of this talk previously. It was called Viruses and Vaccines, and I added an additional V for this one, Viruses, Variants, and Vaccines, because I think that we're all hearing about variants, and I want to spend a little bit of time so that people understand what that means and what the implications might be.
今日咧，我講嘅話題咧係圍繞住病毒同埋病毒株同埋疫苗。
So viruses cause many different human diseases. We're familiar with many of them. This is just a list of some commonly known diseases, which include COVID, which is what we're talking about today, hepatitis, cold sores, chickenpox, flu, skin warts. These are all caused by different types of viruses. And as you can see, they all have similarities, but are all very different from one another as well.
喺屏幕上邊咧，大家見到不同嘅病毒株啦。呢啲咧係唔同嘅疾病嘅，入邊有新冠病毒啦，有見到乙型肝炎，見到有生飛枝或者感冒嘅病毒，個個嘅樣咧都係差唔多，有少少分別，有佢嘅特色咁樣嘅。
So this is a basic structure of virus. There is basically a ball. And I think the best way to think of it is that there are things sticking outside of the ball and there are things that are enclosed in the ball.
你見到個病毒咧，基本上個形狀好似個波咁樣嘅，然後就佢嗰個結構咧就係出邊有一層，同埋入邊有一個中心咁樣嘅。
In particular, I bring your attention to this red structure, which is known as a spike protein that you hear about in the news all the time. This is the thing which enables the virus to stick to the cells of your body and start the infection process.
係啦，大家見到，我想留意嘅咧，大家留意下一條紅色嘅一支支好似條刺嘅嘢咧，就係最重要嘅部分，因為呢個部分咧係會黐喺我哋人體嘅細胞而感染我哋生病嘅東西。
And there are also proteins inside the virus, which after it attaches is actually injected into our cells, which then is used to make more copies of the virus. And that's how the virus multiplies.
喺呢個病毒中心藍色呢啲咧就係蛋白質嚟㗎，就係因為有呢啲蛋白質咧入咗我哋人體之後咧，就會不停複製而引致我哋生病。
Our bodies, however, do have mechanisms to defend itself. And this is shown in this picture. So this is that virus particle that I described before, and this is the spike protein. And what happens with an infection is that our immune system learns to make antibodies which will attach to the spike protein and begin the body's fight against the virus.
大家睇到熒光幕呢啲咧，真係病毒個樣嚟㗎喎。你見到左手邊一個紅色一粒粒嗰啲咧，就係頭先余醫生講嗰啲刺啦。嗰啲刺一黐咗喺我哋人體細胞嗰度咧，就會引致我哋病。但好彩咧，我哋有一個免疫系統，我哋免疫系統一見到呢啲病毒就會自動製造一啲抗體，而抗體咧就會包住呢啲紅色一粒粒嘅嘢，防止侵害我哋嘅身體健康嘅。
On the right is the basic structure of the antibody. And your body makes many different antibodies that can bind to different parts of this spike protein. So it's not simply one antibody, it's many millions of antibodies binding to different parts of the same molecule.
喺右手邊你見到藍色嗰啲咧，就係我哋嘅抗體嚟㗎啦。個抗體咧就會黐住呢啲咁樣嘅病毒突出嚟嗰啲嘢。我哋身體有成千上萬喎，幾千萬嘅抗體嘅喎，同埋唔同抗體有唔同嘅功能。
So the principle of vaccines is to take a piece, just take this part of the spike protein without the ball and everything else, and mimic the infection by using a safer option.
係啦，咁呢啲抗體咧，主要咧係針對呢啲咁樣嘅一條條呢啲針刺，希望將佢嘅數目減低，低到咧唔會影響到我哋人體健康。
So I'm going to skip this, but I'm not going to talk too much, but basically it's taking this small piece, which is just the spike protein, and making it so that your body will be able to make antibodies only against the spike protein.
嗱，我好簡短講一講呢個比較複雜嘅圖，主要嚟講咧就係我哋嗰個抗體點樣去保護我哋，將呢一個病毒去撳住佢。
Now, the idea of vaccines is not new. In fact, it wasn't even started in this country by doctors. The first person to use vaccines in reality was the first president of this country, George Washington, who during the Revolutionary War tried to prevent smallpox by exposing his soldiers to other people who had smallpox, so they get small amounts that they can build antibodies against the infection.
我哋講一講疫苗嘅起源啦。早喺我哋嘅第一任總統華盛頓嘅時候，當時嗰個牛痘嗰個好風行嘅，亦都好多人死於呢一個叫天花嘅病毒。咁華盛頓就將患咗呢個天花病嘅軍人咧，混埋一啲健康嘅人度，等佢引起有一個抗體，有一個免疫嘅個作用。疫苗呢個就係咁樣嚟嘅，呢個觀念就係咁樣嚟。
I don't want to get too deep into politics, but this is an example of where government steps in to protect people at large and asks the people to participate.
正如華盛頓當時點樣保護佢嘅軍隊，今日我哋嘅政府咧，亦都要保護我哋嘅市民，希望用疫苗咧，免我哋受到疫情嘅侵害。
So you notice this is 1777. It wasn't until 1796 when doctors actually began to do this more widely.
係啦，跟住咧過幾年到1796年咧，越嚟越多醫生開始用呢個方法，將健康嘅人同唔健康嘅人喺埋一齊，得到呢個免疫抗體嘅。
So this might be more familiar. This is President Roosevelt in the mid 1900s, who, when he was younger, developed polio, which caused weakness in his legs. And you can actually see how thin his legs are compared to his arms. They're roughly the same size. He couldn't move his legs.
係啦，跟住我哋嘅羅斯福總統咧，佢大家都可能知道佢係有小兒麻痹嘅，你留意到佢對腳咧係唔同 size。當時咧仲未有呢一個疫苗㗎，啱啱開始研發呢個疫苗。
So he made it his life mission to develop a vaccine against polio, which was devastating many of the children of that day. And we developed 2 vaccines during as part of that effort.
就係羅斯福總統咧，全力去投資研發呢個小兒麻痹症嘅疫苗，成功研發到出嚟。
But now we're facing a different crisis. And this is from the studies of the early coronavirus vaccine from last summer. And this is to illustrate how effective it is. The blue line represent the number of people who developed COVID, who got the vaccine. And the red are the people who did not get the vaccine. So you can see how effective it is over a long haul. And this is about 1 to 2 weeks when it starts to separate. So even after 1 week after vaccination, you'll see benefit in people.
嗱，你喺呢個圖咧見到啦，嗰個紅色嗰條線咧就係冇打針嘅人。隨住時間咁樣去咧，你見條線向上升嘅咧，即係話越嚟越多受感染嘅咯喎。藍色嗰條線咧就係打咗針嘅病人。嗱，下面人打完針之後，你見到嗰條線保持水平線嘅，冇越嚟越多人受感染，咁證明嗰個疫苗嘅有效性。通常咧打一針咧已經有一個保護作用啦。
So the vaccine came out just before Christmas, and I felt it was the best Christmas present that I ever got. And this is me getting the vaccine at our hospital.
係啦，啱啱過去嗰個聖誕節咧，我收到一個最好嘅聖誕禮物，就係可以接種呢一個新冠疫苗。我當時就係你睇到幅相，我喺醫院入邊接種疫苗嘅情況。
And despite early challenges and confusion in terms of getting vaccines out to everybody, at least in New York, we've been doing quite a good job, and there is no problems with accessibility at this time. So over the past several months, in New York City at least, over 70% of patients are now vaccinated.
我哋好好彩喺呢個紐約市入邊咧，有好多疫苗供應，唔似其他國家有短缺。目前為止，我哋紐約市已經有70%嘅人口咧接種咗疫苗啦。
I was particularly pleased to see this in the Times about a month ago, about how community activists have been reaching out to the Asian community. And I guess it's a testament to that Asian overachievement mentality that we have. We are number one in terms of getting vaccinated.
啱啱喺幾個月前睇到紐約時報報道呢一篇新聞，好感謝社會工作者啊，有啲志願團體啊，一路不遺餘力咁樣出去勸我哋個社區群眾去接種疫苗。我哋咧亞裔咧係我哋成個城市最踴躍參加接種計劃嘅族裔嚟嘅。
So I just want us to take a moment to just remind ourselves what has actually happened this past year.
跟住咧，我就想講一講我哋過去有幾多美國人因為新冠而失去生命。
So the pandemic started in February, March of last year. The first death in the United States occurred in February. And it took about 4 months before 100,000 people died, which is, in retrospect, and we don't even think about it, but that was incredible then. But then it took another 4 months for the next 100,000 people. It took only 3 months before the next 100,000 people, 1 month for the following, and then less than a month after that.
你睇到呢幅圖咧，都幾驚人。點解咧？你睇到前由10萬人感染係短短4個月嘅時間，跟住4個月又有10萬人，總共20萬，跟住只係短短3個月時間咧，已經10萬人咯喎。跟住至到今年年頭咧，只係1個月到時間已經10萬人，你見到嗰個增速咧係十分之快嘅，令人有啲焦慮。
So this period here was a particularly scary period for all of us, where it seemed like it was just shooting up to the moon. But then you can see something happened, that from February of this year until just this past week, really, that was 100,000 people who passed away. But look how shallow this is compared to this. What happened? Well, what happened was that during this period of time is when we vaccinated people.
大家見到咧，喺今年嘅1月至到3月中間咧，嗰條線上得好快，喺短短嗰3個月咧， 升咗成差唔多10幾萬人嘅病人。跟住喺3月 ，sorry I haven't finished.
No, no, go ahead.
跟住咧，你見到條線開始平翻啦。點解會平翻咧？就係因為個疫苗開始展開疫苗計劃，所以大家見到係有幫助嘅。
So these are confusing, so please don't get caught in the details. But this graph shows the number of cases, not the number of deaths, but the number of cases of COVID. So this was early on, this was the first wave, this was the second wave, and this was that massive wave that we suffered through at the end of the last year.
呢個圖咧就睇到由舊年1月至到今年6月之間有幾多人感染。你見到初頭每一個好似山仔咁嘅形咧，就係一個 wave 一群人咁樣感染。你睇到係慢慢升下，升到最高嘅時候就係舊年10月嘅時候，最多人感染。
So remember, these are just the infections. These are the deaths. And you can sort of see the same pattern. You have this peak here, and then this peak at the end of last year and early this year.
係啦，呢個咧就係幾多人死於新冠病毒嘅。你見到嗰個波浪嘅形咧，同之前嗰個圖係差唔多。咁你見到最嚴峻嘅時候就係舊年11月至到今年3月間最多死於呢個新冠嘅。
But you notice something interesting when you compare the two. So this I just put the two graphs together. This is the cases, these are the deaths. So you can see how there were relatively few cases early on, but a lot of deaths. And then this had more cases, but you actually had even fewer deaths here. And then despite the fact that you have all these cases, this was just a little bit more than this. So the shape of these are different. And nowadays, if you get infected, there are more treatments and we're able to keep people alive. So even though things are still bad, I bring this point up that we are much better in terms of keeping people healthier, safer out of the hospital.
大家留意到兩個圖比拼嘅時候咧，雖然嗰啲波浪形係差唔多，但係我想講出嚟咧就係嗰個感染人數多。初頭第一個波浪，你見到因病毒死去嘅人數咧更加多，但係隨住時間咁落去咧，死於新冠嘅人數咧開始減少。雖然仍然有好多人感染，但係死亡人數減少。就係因為隨住時間，我哋醫學上面嘅進步，醫生揾到更多診治嘅方法去救呢啲感染病毒嘅病人，所以得到一個可以有一個痊癒嘅機率。
So this looks like it's good news, and certainly by comparison to what we're facing is wonderful news between the vaccine and the treatments. So what's the problem? What is really the challenge facing us in the future? Well, what the problem is that the virus itself isn't standing still. The virus itself are developing changes that might make them more difficult to treat or more resistant to the effects of the vaccines.
咁大家聽落似乎係一個好消息喎。我哋醫學上邊揾到治療方法去控制呢個病，我哋應該好開心至係㗎。又有疫苗幫我哋防護。跟住落嚟，我哋嘅憂慮係乜嘢咧？其實個憂慮就係呢個病毒本身咧唔會企喺度唔變嘅，係會一路係咁變種，變落一啲更加比較容易傳染嘅病毒株，去影響我哋嘅健康。
So what we're talking about is what you hear in the news all the time called variants. And we're not going to spend a whole lot of time on this, but essentially, if you imagine this as that original spike protein that we made a vaccine from way back when, and you have you can imagine all the antibodies that are sticking to it. Well, you might have subtle changes in this protein now in some of the viruses we see that the antibodies will no longer be able to bind as well. This reminds me of those little books that my children used to look at where they have two similar pictures and you have to look for the differences. So you can see here is a little bit different from here, say, right? Or here is a little bit different from here. And so if there was an antibody that was adherent to this, it might not be adherent to that. And that's the challenge, because right now we only have vaccines to the original strains. I'm sure they're developing vaccines to the variants as well. But until we get everybody vaccinated, we're all going to be in danger.
大家見到呢幅圖咧，就係兩種唔同嘅病毒株，一個係已經變咗種，你望落去好似差唔多咁嘅形狀，咁嘅顏色喎，但係其實你細心望清楚啲咧，係有些少唔同嘅。就係呢些少唔同咧，已經令我哋身體嘅抗體冇辦法去抵禦佢哋啦。而我哋目前嗰個疫苗咧，係可以保護我哋個原本嗰個病毒株。對新嘅病毒株咧，亦都有些少嘅保護力，但係問題關鍵所在就係要我哋全部人一齊接種咗疫苗之後，抵抗咗個原本嗰個病毒株先，咁去迎接以後嚟嘅新病毒株咧，就會更加容易啦。
And that's really the end of my formal presentation. Thank you, Liza, for translating. I'm happy to go over any of this with anybody. It is complicated even for those who are in this field. So don't feel like you have to, again, know it all.
醫生嗰個講完啦，佢咧就話：如果你唔明咧，唔好擔心，因為其實呢個實在係一個好複雜嘅病情嚟㗎。咁若果你不停咁樣去學習，去保護自己，最緊要就係保持一個警惕嘅狀態。好啦，跟住落嚟咧就係個答問時段。我哋有啲朋友咧已經提問咗啲問題，咁我哋不如請阿余醫生解答下。So following is a Q&A forum. We have some members already submitted some questions. So let's go over it one by one together. So let's start with the first question. 我哋首先睇睇第一條問題先。有朋友問：目前有冇一啲接種咗疫苗嘅狼瘡病人數據同埋研究呢？有幾多人接種咗啊？或者有幾多人產生對新冠病嘅抗體呢？ Is there any data and research on lupus patients who've been vaccinated, such as how many people have been vaccinated, how many people have developed antibodies against the new coronavirus?
So there are a lot of studies going on at different centers, not just in this country, but around the world. Lupus patients, many have been vaccinated. How many, I'm sure that number is known. I don't know it specifically, but it is safely used in patients with lupus and in other autoimmune diseases. In terms of how many people develop antibodies, this is a more difficult question because we don't routinely check people in general for antibodies. This is because the generally available commercial antibody testing for coronavirus doesn't test against the spike protein. It just tests against actually an internal protein. So that will tell you whether or not you make antibodies against the vaccine.
呢一個問題咧，我冇一個明確嘅答案，因為目前為止研究咧係全世界所有科學家一齊攜手做緊。咁我哋so far知道嘅咧就係狼瘡病人同一般嘅病人咧都好安全， 接種呢個疫苗嘅，冇話特別有啲風險。而我哋亦都唔會常規性咁樣去 check 下呢啲病人係患有啲咩特別嘅前科病。我哋只知道疫苗嚟講咧係冇咩分別，對狼瘡病人同埋一般病人嘅副作用或者抗體嘅反應。Thank you. So next question. 我哋有幾多人會因為接種咗疫苗而導致到狼瘡病復發？有幾多人會產生副作用呢？ So how many people have recurrence of lupus due to vaccination, and how many people have serious side effects?
Well, again, like before, these are not easy studies to do. Some people feel that lupus patients may be more at risk for vaccinations, for flares. That really hasn't been borne out in several studies at this point. I would ask people to just remember what we talked about before, that the vaccination is supposed to give a small mimicking effect of the actual infection. So whatever side effects, whether it's a recurrence of the lupus or any other complication that you might get from the vaccination, you will certainly get if you actually get the real infection. And worse, because the vaccine is just a one-time, the virus will multiply and self-perpetuate until the body can handle it.
嗱，呢個問題同剛才嘅問題都差唔多，係非常難解答嘅，因為目前我哋嘅研究咧都未有確實嘅答案。但係咧，我可以清楚啲講一樣嘢，就係我哋之前頭先講過嗰個疫苗。如果你唔中疫苗，染到個病嘅情況會嚴重。但你中咗疫苗之後有副作用咧，嗰副作用只不過係一剎那嘅啫。如果你唔中疫苗，嗰個副作用會持續更加耐，同埋嚟得更嚴重嘅。所以大家可以衡量下中疫苗嘅好處。
A lot is written and publicized about side effects of vaccines. And I caution people not to overread what the newspapers tell you. So for example, just yesterday, I saw an article about a very rare complication of the vaccine, which has been reported only 1,200 times. And that's out of 300 million people who were vaccinated. That means that the percentage is 0.00004% chance of the complication happening, and yet it makes the newspapers.
想提大家喺傳媒喺報紙咧，你會見到好多報導關於副作用嘅。咁咧，佢希望大家咧唔好太過重視呢啲報導。點解咧？因為有副作用，例如我最近見到有一個報導係發生機會係0.0004% 嘅啫，係非常之微嘅發生機會，但係已經受到傳媒嘅大力報導啦，咁可能會影響到我哋嘅心理喎。下一條問題，狼瘡病嘅人打咗疫苗之前，狼瘡病人打疫苗之前需要做咩準備呢？譬如需唔需要調整我哋嘅藥物？打完疫苗又要注意啲乜嘢呢？ What preparation should be made for lupus patient before getting vaccinated, such as what medications may need to be adjusted? What should we pay attention to after the vaccine?
Well, this is a great question and very important one. The answer to the second part of that is you just pay attention to the stuff that anybody else might pay attention to with the vaccine. In terms of medications, many of the medications that are used for lupus may lessen the effects of the vaccine. It's not that they will interact with the vaccine. So there are guidelines that are published by the American College of Rheumatology, which is our governing body, in terms of which medicines you can consider maybe, well, some which you don't have to stop at all, okay? But there are some that may need considering in terms of the timing or whether or not you should change the medicines. But that should be taken on an individual to individual basis because, of course, we're balancing between the disease, the infection, the medicines, and the vaccine, and each person is going to have a different set of circumstances.
呢條問題咧係非常之好嘅問題。首先打完之後要注意乜嘢咧？我可以話狼瘡病人同一般病人需要注意嘅嘢都係一樣嘅。至於狼瘡嘅藥物需唔需要控制調控咧？喺我哋美國風濕學會已經一路研究緊咧呢一樣嘅項目。有啲藥物係需要改變嘅。點解咧？因為佢會減低疫苗對我哋嘅效用。有啲藥物咧需要調整嘅時間啦，調整嘅劑量啦，或者要轉咗佢。各人嗰個狼瘡病都唔同，因人而異，所以要同你嘅醫生攞出嚟商量，係就你個人嘅健康情況去作調整。下一條問題啦，疫苗對正在服用狼瘡藥物嘅患者嘅效力是否會較低？例如羥氯喹、類固醇同埋其他免疫抑制劑。如果係嘅話，就百分比而言會降低幾多呢？抗體係咪仍然足夠可以避免嚴重嘅併發症或者長期嘅新冠病？Is it true that the vaccines are less potent for patients who are taking lupus medication? For example, Plaquenil, prednisone, and other immunosuppressant drugs? If so, how much less potent in terms of percentage? Are the antibodies still sufficient to avoid severe disease or long COVID?
So there are many different questions here. And even in each question, there's sub-questions. Plaquenil is not an immunosuppressant, and so that's not a problem specifically. Prednisone depends on and other steroids will depend on the dosage. So low dose is not a problem, higher dose could be more of an issue. And even amongst immunosuppressant medications, some are going to be worse and some not so bad in terms of the effects on vaccinations. I think the one medicine which is giving us the most worry right now on this issue is rituximab, which some people may be taking. It's not widely used, but it certainly is used in lupus. As for the second, as I said before, it really depends on the medication. And so Plaquenil will not affect the potency of the vaccine. It's a bit early to talk about long-term disease, but it certainly is, antibodies are certainly protective against severe disease, even in lupus patients on medications. And a lot of what we're thinking now is perhaps lupus itself and other autoimmune diseases themselves may not be the risk, but a lot of the other kinds of medical problems that lupus patients may have concurrently may be more of an issue, like diabetes, hypertension, and other things that go along with lupus. So lupus or sarcoid or other conditions by itself may not be the higher of the risks.
呢個問題咧有幾個層面嘅。首先 Plaquenil 唔係免疫抑制劑，所以佢係唔會減低疫苗嘅效用嘅。類固醇咧，如果你係低劑量，譬如5個mg 咁樣咧，亦都唔會影響嘅效用。但如果高劑量嘅話咧，就會有啲影響。咁另外免疫抑制劑咧，睇視乎你用邊一隻藥啦。有啲咧係會令嗰個效用低啲嘅。而家最受關注嘅咧，嗰隻免疫抑制劑叫做 rituximab。rituximab 呢隻藥咧係會減低呢個疫苗嘅效用，所以你同你嘅醫生商量點樣去調教啦。咁另外至於長遠嗰個併發症，目前嚟講咧，仲係尚早，好難定斷究竟呢個病對我哋狼瘡病人日後有啲咩嘅併發症。 暫時嚟講冇數據。但係當狼瘡病人有其他嘅病症，譬如糖尿病啊、高血壓等呢啲咁樣嘅病症嘅時候咧，佢哋嗰個疫情對佢哋嘅影響係特別大啲嘅。但係如果淨係單就狼瘡嚟講咧，係冇話特別嚴重、更加嚴重嘅病症嘅。第5條問題，我已經打咗強生理疫苗啦，我以後若果要打加強劑，可唔可以改牌子咧？I have taken Johnson & Johnson vaccine. Can I switch to other brands, for example, Pfizer, in the future for booster shots?
There are two aspects to this question. One, are there benefits by doing so, which no one really knows because the studies haven't been done. And it's kind of can't be measured because there's just not enough people. Anecdotally, on the other side, is there a danger to that? Anecdotally, I have had people in this situation, and I've heard around the world even, where people have gotten both, but have not had any complications, for what it's worth. But there are just too few people at this point, too little to be known about this question.
呢個問題咧，就暫時嚟講，未有一個研究去深入去調查，亦都唔夠人俾我哋去做呢一個調查。但係聽外國同行講咧，全世界可以聽得到個同行所透露嘅咧，曾經有人係試過轉牌子疫苗，但係咧就冇咩特別嘅副作用。只不過好少量嘅咧係有不良嘅反應，總括嚟講咧係冇副作用。但係要進一步再多啲研究咧，先至可以確實呢啲數據。好啦，第6條，輝瑞同埋莫德納嘅疫苗能夠預防印度新變種病毒株嗎？Will the vaccine from Pfizer or Moderna protect against the new Indian variant?
So this is a question of degree. Any vaccine should protect compared to not getting a vaccine at all. I think the question is it as protective against this variant compared to the original? And this goes into the whole idea, as I showed you in my last slide, the idea that, if an area of the molecule changes enough, then in theory, of that particular molecule, in theory, it may not be as effective. But you will still have other antibodies in other areas of that molecule, so you'll still get benefit.
如果講可唔可以保護到呢個印度病毒株咧？未必可以好似嗰個原本嘅病毒株咁有效。你見到頭先我俾大家睇到嗰幅圖，兩個病毒株望落好似差唔多樣，但係咧有些微嘅變異咧，嗰個效用已經有唔同㗎啦。但係有幾多唔同咧？有幾多分別咧？目前為止我哋都未能確實講清楚。但係我可以知道嘅咧，就係我哋個現時嘅疫苗係可以保護到，某程度上可以保護到個新變種，但係唔會好似原本嗰個病毒株咁強嘅保護力，係會低啲嘅。好啦，第7條問題，同血小板減少症相關嘅疫苗併發症有冇更新嘅資訊啊？Any new updates on complications from the vaccines relating to thrombocytopenia, low platelets?
Well, this complication is rare, and when it happens, it requires medical attention. But like any other complications, I would emphasize the point that the vaccine mimics the infection, but to a lesser degree. So any complications that you get from the vaccine, you can expect if you actually got infected with the real virus. And you just rather get it with the vaccine than if you had the virus.
目前嚟講係對血小板少嘅病人嚟講，疫苗有冇併發症咧？係有，不過係十分之少。個數據嚟講咧係好少。咁我重新想提大家咧，就係打完疫苗之後嗰個副作用咧，實質就係當你感染咗新冠之後嗰個副作用嚟嘅，嗰個病徵其實係差唔多。唯一唔同嘅咧，就係你真正感染咗新冠之後，嗰啲症狀咧會比你打疫苗嗰個副作用大10倍，甚至乎20倍、30倍，會更加辛苦。所以點解唔不如打咗個疫苗，受些少嘅副作用，去預防日後有機會染上呢個疾病咧？好啦，我哋想懷孕嘅病人需唔需要留意呢個疫苗有冇產生咩副作用啊？有冇咩特別建議咧？ Do we know of any side effects the vaccine may have on patient with lupus trying to conceive? Any advice?
Well, this is a small group of people, young women with lupus, to begin with. I can say that the vaccines seem to be safe in women without lupus, who are trying to conceive or who are pregnant. I can say that there probably are no side effects of note in lupus patients in general. So if you put those two subsets together, there probably isn't any problem. And certainly not with conception. I think the question often revolves around what happens if someone's already pregnant. So the conception issue, I don't think is an issue. There may be questions in terms of pregnancy.
呢個問題咧係關於婦女嘅啦。如果冇狼瘡病嘅婦女想懷孕咧，打呢個疫苗係冇咩關係嘅。如果你有狼瘡想懷孕嘅咧，嗰個有副作用機會率仍然係好低。反而咧，我會更加關注嘅咧就係已經懷孕咗個婦女，若果要接種疫苗咧，就要需要同佢哋醫生一齊去商量下先，點樣去應付，因為每個人嘅身體係唔同嘅。好啦 ，next question。當我哋社會重入呢個社會啦，所有而家啲餐廳都開始開返啦。我哋點樣喺公眾場所、戶外同埋室內安全咁樣同其他人互動咧？狼瘡患者喺全面接種咗之後，除咗一般大眾，仲要需要其他咩預防措施嗎？公共場所戴口罩同埋社交距離仲需唔需要咧？ As we re-enter the world, how can we safely interact with others in public, outdoors and indoors? Lupus patients need other precautions besides general public after being fully vaccinated. Mask or social distancing in public?
Well, I think a couple of, I don't have a general, rule here. If there's anything general is try to be mindful and aware of what's going on around you at the time. If you are in a setting where someone's coughing, you want to avoid that setting. So it's not so binary. It's not, this or that. So I'm still an advocate for masking and social distancing despite government advice. And certainly, obviously I can take the mask off if no one's around. But if I'm in a restaurant, I will, and unless I'm eating, I'm still wearing my mask. But I think the more important thing is be smart, okay? Don't put yourself in a situation where you're likely to get it, and act accordingly.
呢個問題咧，其實就係要需要大家用下你哋自己嘅個人分別能力，用你哋嘅智慧。點解咧？雖然而家政府冇規定我哋戴口罩同埋保持距離，我做醫生嚟講咧，我出去咧我都會戴翻個口罩同埋保持距離㗎。尤其是當你隔離個人喺度打緊乞嗤咳緊嘅時候，你一定要保持警覺㗎。 咁若果你出去冇咩人嘅話，喺一個新鮮嘅空氣、空曠嘅地方，咁你除低嗰個面罩，當然冇咩所謂啦。所以係好視乎你當時係身在咩場合，有幾多人喺你身邊，同埋要你自己嘅智慧去做一個辨別。好啦，仲有一條問題就係，如果我屋企人未接種呢個疫苗，我應該點樣同佢互動呢？若果我感染咗呢個新冠病，我應該點樣同我家人講呢？ How should I interact with family members who aren't vaccinated? What should I tell my family if I have COVID?
Well, the first thing I would ask is, why aren't you vaccinated? And I have a really open discussion as to why. Then you wouldn't have this question, right? But if you have family members who refuse to be vaccinated, it will depend a little bit on, I guess, more of the social, how important it is for you to interact with them. I came across this question just yesterday. A patient of mine called who had visitors coming in. One visitor decided that they didn't want to be vaccinated. The two people weren't that close. So I advise, if you're not that close, then she puts you in danger, then you have to avoid. But I would open up the discussion, really, why aren't you vaccinated? The second question, what should I tell my family if I have COVID-19? Well, remember, COVID-19 is just that period of time where you're actually infected. So if it's during that time, those 2 weeks, then they should be tested and they should be quarantined. If we're talking about long haul, which is more of the after infection effects that sometimes occur, you're no longer contagious, then you can be with them. But if you have symptoms, you have to explain to them, well, I'm having symptoms because of my prior infection.
好啦，我會點解第一個問題我會問，點解你嘅家人仲未接種疫苗呢？呢一個係值得討論嘅話題，因為接種疫苗咧係十分重要。咁如果佢哋決定唔接種疫苗嘅話，咁你睇下係個關係啦，係咪咁親密啦？因為可以好似我最近邀請幾個朋友嚟，其中一個咧係冇打疫苗嘅，咁佢就話佢應唔應該去呢個 party 咧？但係最後決定我同佢都唔係咁熟，橫掂佢都未打疫苗，我都係唔好去啦，寧願安全啲好啲。就係呢啲咁嘅決定咧，大家要需要自己做啦。若果你感染咗新冠病，當然頭嗰2個禮拜你要隔離啦，因為你唔想傳染俾你家人。但係2個禮拜之後你好返之後咧，一樣可以同你家人正常接觸。若果你仲有症狀嘅話咧，你可以解釋家人聽，我已經好返啦，只不過係仲有少少持續嘅症狀，都冇問題嘅。Okay, I think we've gone over all the questions. Thank you, Arthur.